is an important and growing field of science, and dental researchers and surgeons worldwide are working hard to give us all a reason to smile. Hi, I'm Nika Baram, and I recently starred in a movie called Smile, based on the real-life story of a student like you who learned about healing and caring by working with an organization called Operation Smile. Operation Smile helps children and young adults all over the world receive surgery for oral and facial deformities. This can mean the difference between a life of loneliness and pain or a life filled with smiles and health. You can become involved with Operation Smile as well, or you can choose to study oral health science and become a dental researcher, like the women you will meet in this program. Whether you help people feel better because you fix their problem, or use oral health science to discover new treatments for disease, your life as a dental researcher can be both challenging and rewarding. The scientists in this program have made a difference in the lives of thousands of people through their research findings and practice. Join us now for Women in Dental Research to see how and why they chose this path.
As you'll find out in this program, you don't have to be a trained dentist to be an oral health researcher. But the history of dental research begins with dentists. We'll start our exploration of dental research here at the National Museum of Dentistry in Baltimore, Maryland. This was the site of the first dental college in the world, so it's a perfect place to get a little refresher on our dental history. Don't forget to floss. And now, for a brief oral history. As long as we've had teeth, there have been people who made their living working on teeth. The pharaohs of ancient Egypt had toothists. The Mayan Indians did cosmetic dentistry in 900 AD. You've heard of the traveling salesman. In the 1700s, you could be visited by the traveling dentist. No Novocaine, no drills, just this icky-looking corkscrew thing. Yikes! But all that changed in the 19th century when dental colleges began to open up all over the United States. Starting with this one. Dentistry was finally becoming a science-based health profession with lots of homework to prove it. Most dental colleges did not accept women, but a few did, and the first women dentists were trained. Lucy Beeman Hobbs Taylor was the first woman in America to earn a doctorate in dentistry in 1866. Ida Gray Nelson graduated as the first female African-American dentist in 1890, and Vida Latham became the first woman in history to earn both a dental degree and a medical degree in 1892. In 1918, only 5 women graduated from dental colleges in America. In 2001, more than 1,600 women graduated from U.S. dental schools. Many of these women went on to become leaders in the field of oral science and dental research, like our first featured scientist, clinical researcher Dr. Deborah Greenspan. More than 25 years ago, in San Francisco, Dr. Greenspan found herself at the forefront of an epidemic, which was still largely a mystery to the rest of the world. Her scientific discoveries about HIV/AIDS and related illnesses changed medical history, and her safety initiatives helped transform dental practice everywhere.
When you are treating people when they come in with a problem, what happens is you look at the problem and you run through a series of possibilities, things that you know about, and you will have at your fingertips the right way to go about treating it and managing it. But sometimes it isn't quite so clear, and sometimes things aren't so obvious, and sometimes things are a little different. And it is those things that set you on the path of asking, why is this different? What is it? And how do we find out what it is?
As a dental researcher, Dr. Greenspan has always used her professional curiosity to uncover the mysteries of oral medicine. In the late 1970s, she was studying white spots on the tongue, commonly called thrush, when she noticed that more and more lesions had mutated in an unusual way.
I was seeing something in the mouth that I had never seen before. In my field, we call white patches leukoplakia. Leuko is white, plakia means patch, and so I called it hairy leukoplakia, a hairy white patch. And we began to realize that we were looking at something that might possibly be connected with the newly recognized AIDS epidemic.
An unofficial research task force, including her husband, oral pathologist Dr. John Greenspan, banded together to share knowledge and information about the newly discovered disease called AIDS.
We would have people from all over San Francisco, from the different clinics that were seeing people. We'd have people from the blood banks. We had everybody who would come into this meeting who were interested in finding out more. What are you seeing this week? What are you doing for this? How can we manage that? We were all there, all working together, all seeing patients. There were no barriers, no borders. It was the best of clinical care and the best of science. San Francisco established the model.
One of Dr. Greenspan's early discoveries was that hairy leukoplakia, by now its official name, was found in those who were infected with the human immunodeficiency virus called HIV because their immune systems were compromised. The next step was discovering what virus was causing this new lesion.
So understanding that we had a clinical problem, finding that it was associated with one virus, but in fact then with further research, recognizing that this was associated with a virus called Epstein-Barr virus, and this was absolutely amazingly new and unheard of.
Epstein-Barr, the virus associated with mononucleosis, used to be extremely difficult to study. With the discovery of hairy leukoplakia, scientists now have ready access to obtain the virus. Dr. Greenspan had transformed oral AIDS research. Next, she helped transform the practice of dentistry itself. When scientists learned that HIV was transmitted through blood and other bodily fluids, Dr. Greenspan led a revolution at the UCSF School of Dentistry by enforcing safety regulations that are now taken for granted all over the world.
Within a period of a year, we had totally changed the way we practiced dentistry in this school. From short white coats that were worn by the dental students that they took home to launder, we moved into blue gowns that were for hospital laundering, masks to prevent nasal transmission, eye guard to prevent eye transmission, and gloves which we changed from every patient. Huge protests. We were asking dentists who'd never worn rubber gloves to do general dental procedures to wear rubber gloves. And anybody who now goes to the dentist today, the dentist would say, well, of course, this is how we do practice. So I really think that here in San Francisco, we were pioneers. We showed it could be done, and we showed that it could be done very quickly indeed.
Dr. Jennifer Webster Surratt.
Research is a process, and we're continually building on the findings of other people. And so our hope is that each contribution that we make will be something that someone else can build upon.
Dr. Webster Surratt was still a dental student when she discovered the work of earlier dental researchers like Dr. Greenspan and realized there were a lot of mysteries to solve in the mouth.
I got really interested in pathology and disease in dental school, but really frustrated that if you look at our pathology books where they describe the oral diseases, many of them say etiology unknown or idiopathic, which means we don't know what causes any of them.
Her interest in finding out what causes oral diseases at the molecular level brought her as a graduate student to University of North Carolina, Chapel Hill, where she earned a dental degree as well as a PhD in basic science at the School of Dentistry. Today, Dr. Webster Surratt is a member of Chapel Hill's faculty, maintaining a busy schedule that strikes a perfect balance for her between the dental chair and the laboratory bench.
I work in a hospital dental clinic, and this is a clinic for people who can't be seen in a regular general dental setting because they're hemophiliacs, or they have had cancer, or they're going to get a transplant, or they have AIDS. And a lot of times, because of their disease or their immune suppression, because of the medications that they're on, they'll develop interesting oral lesions. My research is on how those lesions develop. If we understand what they're doing, we can target them therapeutically and stop them.
Dr. Webster Sirach spends several days each week practicing dentistry in the hospital and dental school alongside residents and dental students. Sometimes she goes to the main hospital floors to treat immobile patients at their bedside. And in the afternoon, she heads to the dental clinic to see healthy patients. Her clinical work supplies her with materials to take back to the laboratory, where she spends the other days of the week in research at the bench.
I hope you enjoyed learning about dental research as much as I did. It's a career where you can be a modern medical detective and make scientific discoveries that help us all. These women have done it. You can too, if dental research is the path for you. I'm your host, Wanda Lis. Thanks for joining us today for Women in Dental Research.